When I go to work, my heart's in it, and we hit the ground running. We have an extremely busy practice. However, I really make it a point to take time with each and every patient. I really love what I do, and I think when someone really loves what they do, they'll bring their heart to work every day. My name is Dr. Michael Maskull. I am a foot and ankle specialist, and my practice is located at the Paw Paw Lake Medical Center in Coloma, Michigan. My dad is a primary care physician in Grand Rapids, Michigan, and has been for the past 35 years. So I've been interested in medicine from the get-go. My field is podiatry. I went to Podiatry School, did a podiatry residency. It was a surgical, primarily orthopedic foot and ankle residency in Pittsburgh, Pennsylvania. And I had the unique opportunity from that point to do a foot and ankle orthopedic fellowship in Portland, Maine. I did a 3-year surgical residency in Pittsburgh, Pennsylvania, under the direction of Dr. Robert Mendocino and Alan Catanzariti. I am married. My wife's name is Jeanette. We got married 12 years ago, and she has been with me from the very beginning, from med school to residency to Portland, Maine, where I did my fellowship, and back here in Kalamazoo and Lakeland area. We have 2 girls. We have a 2-year-old Mackenzie and 4-year-old Bevan Maskill. So they're just awesome. We just love them to death, and they're doing very well. I am a big wakeboarder. So I grew up for the past probably 20 years water skiing and wakeboarding, barefooting. I used to compete in wakeboarding on a national level, and I actually still do compete, and I really enjoy water sports, but wakeboarding in general. Foot and ankle is a great field. It is a great field, and my advice to people that are interested in medicine, or foot and ankle in particular, is to go at it wholeheartedly. I also love to cover sports medicine, such as sports-related injuries. I see a lot of patients from Western Michigan University, as well as a lot of area high schools, both here in Watervliet and in Kalamazoo. And I think that the majority of what I see is chronic ankle instability. Young kids that have both deformities or not deformities, that have had several ankle sprains, and that develop such instability that it really affects them long term. I had a patient that had a severe ankle fracture in the past, probably about 5 or 6 years ago. He was using a cane and a wheelchair for the past few years. He had seen multiple physicians and was told that he was pretty much doomed to a wheelchair for the remainder of his life. I went in and we did an ankle fusion and reconstructed his foot at the same time, which was a very big procedure for this gentleman. And he actually ended up doing phenomenally well. He's not using a cane, doesn't use a wheelchair, and he's back to farming, and his quality of life is dramatically improved.